ನಾವು ಇವತ್ತಿನ ದಿನ when we say that advanced ಆಗ್ತಾ ಇದೀವಿ, ಮೆಡಿಕಲ್ ಅಡ್ವಾನ್ಸ್ಮೆಂಟ್ಸ್ ನೋಡ್ತಾ ಇದೀವಿ ಇನ್ ಇಂಡಿಯಾ ಅಂತ, ಆಕ್ಚುಲಿ ಐ ವುಡ್ ಲೈಕ್ ಟು ಸೇ ನೋ, ವಿ ವರ್ ಆಲ್ವೇಸ್ ಅಡ್ವಾನ್ಸ್ಡ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ದ ಫಾದರ್ ಆಫ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಅಂತ ತಗೊಂಡಾಗ ಇಟ್ ಇಸ್ ಸುಶ್ರುತ. We all have heard about Sushruta Samhita, where Sushruta has mentioned about complex, advanced surgical techniques like even rhinoplasty using forehead skin flaps. Rhinoplasty na ಮಾಡ್ತಾ ಇದ್ರು, a method which is still relevant to this day. So that was the golden age of ancient India. But talking about now, that is 2026, when we talk about plastic surgeries and aesthetic surgeries, ನಮ್ಮ ಮೈಂಡಿಗೆ ಫಸ್ಟ್ ಬರೋದು ಕೊರಿಯಾ, USA, Brazil, ಈ ಥರದ ಕಂಟ್ರೀಸ್ಗಳು ಫಸ್ಟ್ ನಮ್ಮ ಮೈಂಡಿಗೆ ಬರುತ್ತೆ. ಬಟ್ ಯು ಮೈಟ್ ಬಿ ಸರ್ಪ್ರೈಸ್ ಟು ನೋ ದಟ್ ಇಂಡಿಯಾ ಇಸ್ ಒನ್ ಆಫ್ ದ ಟಾಪ್ ಗ್ಲೋಬಲ್ ಸೆಂಟರ್ಸ್ ಫಾರ್ ಪ್ಲಾಸ್ಟಿಕ್ ಆ್ಯಂಡ್ aesthetic surgeries. ಇದ್ರ ಬಗ್ಗೆ to throw some light, ನನ್ನ ಜೊತೆ ಇವತ್ತು on the show Dr. Ashok B C ಅವರಿದ್ದಾರೆ, who's the head of Department of Plastic Reconstructive and Aesthetic Surgery and Chief of Medical Services. Doctor, welcome to the podcast. Namaste.
Namaste, Saujanya. Thank you for having me here. And it's a pleasure to talk about plastic surgery to you today.
My pleasure, Doctor. So can we begin our conversation with talking about the difference between plastic surgery, reconstructive surgery and aesthetic surgery?
Plastic surgery, ತುಂಬ ಜನಕ್ಕೆ ಒಂದು ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್ ಇದೆ. ವಿ ಯೂಸ್ ಪ್ಲಾಸ್ಟಿಕ್ ಮೆಟೀರಿಯಲ್ಸ್ ಟು ಡೂ ದಿಸ್ ಸರ್ಜರೀಸ್ ಅಂತ. ಫಸ್ಟ್ ಆಫ್ ಆಲ್, ವಿ ಡೂ ಯೂಸ್ ಸಮ್ ಪ್ಲಾಸ್ಟಿಕ್ ಮೆಟೀರಿಯಲ್ಸ್, ಬಟ್ ನಾಟ್ ಆಲ್ವೇಸ್. ಪ್ಲಾಸ್ಟಿಕ್ ಅಂತ ಏಕೆ ಬಂತು ಅಂದರೆ, ಗ್ರೀಕ್ ಲ್ಯಾಂಗ್ವೇಜಲ್ಲಿ ಪ್ಲಾಸ್ಟಿಕೋಸ್ ಅಂದರೆ ಟು ಮೋಲ್ಡ್, ಒಂದು ಅಚ್ಚು ಹಾಕುವಿಕೆ ಅಂತ. ಅದರಿಂದ ಅದು ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಅಂತ ಆಗಿದೆ. ಬಟ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿಲಿ ಎರಡು ಮುಖ್ಯ ವಿಭಾಗಗಳಿದೆ. ಒಂದು what we call as reconstructive surgery, other one is called either cosmetic surgery ಅಥವಾ aesthetic surgery ಅಂತ. ಸೊ aesthetic surgery ಅಂದರೆ ನಾವು ನಾರ್ಮಲಿಂದ ಇನ್ನೂ ಚೆನ್ನಾಗಿ ಆಗೋದು, ಅದಕ್ಕೆ aesthetic surgery ಅಥವಾ cosmetic surgery ಅಂತೀವಿ. reconstructive surgery ಅಂದರೆ something which is abnormal, we are making them normal. ಸೊ ಅದು reconstructive surgery ಅಂತ ಎರಡು ಭಾಗಗಳಿದೆ. ತುಂಬ ಜನಕ್ಕೆ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಅಂದರೆ ಕಾಸ್ಮೆಟಿಕ್ ಸರ್ಜರಿ ಅಂತ ಆಗಿಬಿಟ್ಟಿದೆ. ಆ ಥರ ಅಲ್ಲ. ತುಂಬ ಸರ್ಜರೀಸ್ ನಾವು ಮಾಡೋದು ಇನ್ವಾಲ್ವ್ಸ್ ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್. ಅದು ಒಂದು ತುಂಬ ಕಾರಣಗಳಿಂದ ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಬೇಕಾಗ್ಬೋದು. ಹುಟ್ಟಿದಾಗಿಂದನೇ ಬೇಕಾಗೋ ಕೆಲವು ಊನತೆ ಇರ್ಬೋದು, ಕ್ಲೆಫ್ಟ್ ಲಿಪ್ಪು, ಕ್ಲೆಫ್ಟ್ ಪ್ಯಾಲೆಟು, ಕಿವಿ ಇಲ್ದಂಗೆ ಹುಟ್ಟೋ ಮಕ್ಕಳಿರ್ತಾರೆ, ಕೈ ಬೆರಳಿಲ್ದಲೇ ಇರೋದು ಈ ಥರ, ಅಥವಾ ಇನ್ಫೆಕ್ಷನ್, ಅಥವಾ ಆಕ್ಸಿಡೆಂಟ್ ಆಗಿ ಕೆಲವು ಭಾಗಗಳನ್ನು ಕಳ್ಕೊಂಡಿರೋದು, ಅಥವಾ ಕ್ಯಾನ್ಸರ್ ಆಗಿ ಕೆಲವು ಭಾಗ ತೆಗಿತಾರೆ. ಆಮೇಲೆ ಸುಟ್ಟ ಗಾಯಗಳಿಂದ ಆಗುವಂಥ ಕಲೆಗಳು ಮತ್ತು ಕಂಟ್ರಾಕ್ಚರ್ಸ್ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ, ಫಂಕ್ಷನ್ ಎಲ್ಲ ಹೋಗ್ಬಿಡ್ತದೆ. ಆ ಥರದನ್ನೆಲ್ಲ ಸರಿ ಮಾಡೋದಕ್ಕೆ ನಾವು reconstructive surgery ಬೇಕಾಗುತ್ತೆ.
As you rightly pointed out, a lot of people, I think they think and believe that plastic surgery involves plastic, the actual plastic that we see and use. But ನೀವು ಹೇಳಿದ ಹಾಗೆ ಆ ಗ್ರೀಕ್ ವರ್ಡ್ ಪ್ಲಾಸ್ಟಿಕೋಸ್ ಅಂದರೆ ಮೌಲ್ಡಿಂಗ್. ಸೊ ಮೌಲ್ಡ್ ಮಾಡೋದಕ್ಕೆ ಐ ಬಿಲೀವ್ ದ ಮೆಟೀರಿಯಲ್ಸ್ ಯೂಸ್ಡ್ ಆರ್ ಸಿಲಿಕೋನ್, ಗೋರ್ಟೆಕ್ಸ್ ಮತ್ತು ಮೆಡ್ಪಾರ್, ಬಟ್ ಮೋಸ್ಟ್ ಕಾಮನ್ಲಿ ಸಿಲಿಕೋನ್ ವಿಲ್ ಬಿ ಯೂಸ್ಡ್. ಆ್ಯಂಡ್ ಗ್ರಾಫ್ಟ್ಸ್ನ ಕೂಡ ಇನ್ ಸಮ್ ಕೇಸಸ್ ಯು ಯೂಸ್ ಅಲ್ವಾ, ಸೊ ದಟ್ ದ ಬಾಡಿ ಡಸಂಟ್ ರಿಜೆಕ್ಟ್. ಅಂದರೆ ಇಯರ್ ಕಾರ್ಟಿಲೇಜ್ ಬೀಯಿಂಗ್ ಒನ್ ಎಕ್ಸಾಂಪಲ್. ಸೊ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಇಟ್ ಸೆಲ್ಫ್, ಡಿಫ್ರೆನ್ಸ್ ಹೇಳಿದ್ರಿ ನೀವು ಒಂದಕ್ಕಿಂತ ಇನ್ನೊಂದು. ಅಂದರೆ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಅಂದ್ರೇನು, ರೀಕನ್ಸ್ಟ್ರಕ್ಟಿವ್ ಸರ್ಜರಿ ಅಂದ್ರೇನು, ಏಸ್ಥೆಟಿಕ್ ಸರ್ಜರಿ ಅಂದ್ರೇನು ಅಂತ. ಸೊ ಆಲ್ಸೋ, ಆಸ್ ಯು ರೈಟ್ಲಿ ಮೆನ್ಷನ್, ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಪೀಪಲ್ ಬಿಲೀವ್ ದಟ್ ಇಟ್ ಈಸ್ ಯೂಸ್ಡ್ ಓನ್ಲಿ ಫಾರ್ ಬ್ಯೂಟಿಫಿಕೇಶನ್ ಪರ್ಪಸ್, ಟು ಲುಕ್ ಬ್ಯೂಟಿಫುಲ್. ವಾಟ್ ಆರ್ ದ ಮೋಸ್ಟ್ ಕಾಮನ್ ರೀಸನ್ಸ್ ದಟ್ ಪೀಪಲ್ ಕಮ್ ಟು ಯು ವಿತ್ ಸೇಯಿಂಗ್ ಐ ನೀಡ್ ಅ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ? ಇವತ್ತಿನ ದಿನ ನೀವು ನೋಡುವಂಥ ಟಾಪ್ 3 ರೀಸನ್ಸ್ ಯಾವ್ಯಾವ?
ಇವತ್ತಿನ ದಿನ ನೋಡಿದ್ರೆ ದ ಮೇನ್ ರೀಸನ್ ವೈ ವಿ ಡೂ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಈಸ್ cancer reconstruction. Okay. Also depends on where we practice. In certain areas it might be because of road traffic accidents and things like that. And lastly, the third most common would be aesthetic surgery. So ಈಗಿನ ಕಾಲದಲ್ಲಿ number one requirement for plastic surgery is cancer reconstruction, because in India the cancer incidence has increased so much, be it breast cancer in women, be it oral cancer for men and women, lots and lots of areas where they have to remove large amounts of tissues from the body. ಆವಾಗ ಏನಾಗ್ಬಿಡುತ್ತೆ, ಒಂದು ಡೆಫಿಸಿಟ್ ಬರುತ್ತೆ, ಫಂಕ್ಷನ್ ಆಗ್ಬೋದು ಅಥವಾ ಫಾರ್ಮ್ ಆಗ್ಬೋದು, ಹೆಂಗೆ ಕಾಣಿಸ್ತಾರೆ, ಹೆಂಗಿರ್ತದೆ ಅನ್ನೋದು, ಅದನ್ನೆಲ್ಲ ತುಂಬಿಸ್ಲಿಕ್ಕೆ, ಅದನ್ನೆಲ್ಲ ಮತ್ತೆ ಸರಿ ಮಾಡಲಿಕ್ಕೆ ವಿ ನೀಡ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ.
We're talking about aesthetic surgery because general people perception is that ಚೆನ್ನಾಗಿ ಕಾಣೋದಕ್ಕೆ ಸರ್ಜರಿ ಮಾಡಿಸ್ಕೋತಾರೆ ಅಂತ. ಬಿಕಾಸ್ we've seen a lot of celebrities and influencers getting it done, and most commonly ಅಯ್ಯೋ ಸರ್ಜರಿ ಮಾಡಿಸ್ಕೊಂಡು ಅವ್ಳ ಲಿಪ್ಸ್ ಹಾಳಾಗೋಯ್ತು, ಬೊಟಾಕ್ಸ್ ಆ್ಯಂಡ್ ಫಿಲ್ಲರ್ಸ್ ಮಾಡಿಸ್ಕೊಂಡು ಮುಖ ಹಾಳಾಗೋಯ್ತು. ದೀಸ್ ಆರ್ ದ ಕಾಮನ್ ಥಿಂಗ್ಸ್ ದಟ್ ವಿ ಲಿಸನ್ ಟು ಡೇ ಇನ್ ಆ್ಯಂಡ್ ಡೇ ಔಟ್. ಸೊ ಪೀಪಲ್ ಆರ್ ಜಡ್ಜ್ಮೆಂಟಲ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ. ಸೊ ನಿಮ್ಮ ಒಂದು ಎಕ್ಸ್ಪೀರಿಯನ್ಸಲ್ಲಿ ಒಂದು ಪೇಷಂಟ್ ಎಕ್ಸಾಂಪಲ್ ಕೊಡಬೇಕು ಅಂತಿದ್ರೆ, which will always stay with you.
See, it is like this. Somebody wants, I am well to do, I can afford something, I would go and buy a car. Okay, it can be a Maruti car or it can be a BMW or a luxury car. There is no problem at all. The problem comes if I cannot afford that BMW car and I take an EMI, I take a loan on that and do it. That is not acceptable. Same thing, the analogy is same for plastic or cosmetic surgery. If you want to look good, if you want to feel good, and if you can afford it, there are safe ways to do these surgeries, and the results are very consistent if you get it done properly. So there is absolutely no problem with that. The problem comes if you have unreasonable expectations of what you want, or if you are trying to set right some thing in your life by doing cosmetic surgery. Suppose I'm not getting promotion in my work and I think, oh, the way I'm looking, that's the reason why I'm not. That is where the red flag should come, and that is where these things go wrong also. So if somebody wants to look and feel good, absolutely go ahead and do it, provided you can afford it. Okay. There are people who, for example, you are asking an example. There was a marketing executive. All he had was a small deformity of the lower lip, and he was very conscious about it. And he said, I cannot go and pitch in my sales. I am very conscious about how I speak because I feel everybody is looking at my lips only. And I did a very simple procedure and it got corrected. And he was so happy, so happy. 3 years later and came and said that, sir, I have moved to a managerial level now, and I feel this is the thing that changed my life for me. So small things like this will change this thing, but because of other reasons you are not moving forward in your, and you think this will set right, that is wrong. That is wrong.
So I think there are two types of cases. ಒಂದು reconstructive surgeries ಅಲ್ಲಿ you will advise the patient saying, ಇದನ್ನ ಮಾಡಿಸಿದಾಗ, ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿಸಿದಾಗ ದಿಸ್ ವಿಲ್ ಗೆಟ್ ರೈಟ್ ಅಂತ. ಅಂದರೆ ಒಂದು ಬರ್ನ್ಟ್ ಮಾರ್ಕ್ಸ್ ಇರಬಹುದು, ಅಥವಾ ಕ್ಲೆಫ್ಟ್ ಲಿಪ್ ಇರಬಹುದು, ಈ ಥರದ ಒಂದಷ್ಟು ಆಕ್ಸಿಡೆಂಟ್ ಇಂಜುರೀಸ್ ಇರಬಹುದು, ಕ್ಯಾನ್ಸರ್ ಕೇಸಸಲ್ಲಿ ನೀವು ಹೇಳಿದ್ರಿ. ಬಟ್ ದೆನ್ ದೆರ್ ಇಸ್ ಆಲ್ ಟುಗೆದರ್ ಅನ್ ಅದರ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ವೇರ್ ಇನ್ ನಾನು ಚೆನ್ನಾಗಿ ಕಾಣಿಸ್ಬೇಕು, ಫೀಚರ್ಸ್ ಶುಡ್ ಗೆಟ್ ಬೆಟರ್ ಅಂತ ಬರೋರು. ವಾಟ್ ಆರ್ ದ ಮೋಸ್ಟ್ ಕಾಮನ್ ಕ್ವೆಶನ್ಸ್ ದಟ್ ದೇ ಆಸ್ಕ್ ಯು ಅಬೌಟ್ ದಿಸ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ?
The most common question they want to ask is, at the end of it, will I be all right? Will there be no complications? Any surgery we do, at the end they say, doctor, ನಾನು ಸರಿ ಹೋಗುತ್ತಲ್ಲ ಎಲ್ಲ? That is the last question anybody would ask. But in cosmetic surgery, each cosmetic surgery has a different end point. For example, rhinoplasty ಮಾಡಿದ್ರೆ ಸಣ್ಣ ಮೂಗಿರೋರಿಗೆ ದೊಡ್ಡದು ಬೇಕು, ದೊಡ್ಡದಿರೋರಿಗೆ. So biggest challenge for us is to gauge and match what they are asking with what can be achieved medically. There are unreasonable requests sometimes, and they are very, very difficult to match. But understanding what patient or the person who is sitting across and asking me, I want this kind of nose or I want this kind of eyes, and matching that with surgery is the most difficult part in aesthetic surgery. If there is a mismatch in that, that's when the trouble starts.
So ಅದಕ್ಕೆ going to an expert doctor is so important, who has that good amount of experience.
Absolutely,
Yeah.
absolutely. So somebody comes and sits across the table and discuss any cosmetic surgery, any surgery for that matter. it is not just a conversation. Understanding the patient's mind, what they are asking for, and making sure that they understand what I am telling is very, very important. And that's where the experience comes in.
And also, I think people believe that once ಈ cosmetic surgery ಅಥವಾ aesthetic surgery ಮಾಡಿಸ್ಕೊಂಡಾಗ, one thing that they have to digest, the fact that they will still age. They will look good, that they will still age, but ನೀವು ಮಾಡಿದಂಥ ಸರ್ಜರಿ ಟು ಮೇಕ್ ಶ್ಯೂರ್ ಆ ರಿಸಲ್ಟ್ ಇಸ್ ಅಪ್ರೋಪ್ರಿಯೇಟ್, ಅವ್ರಿಗೆ ಬೇಕಾದ ಹಾಗೆ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜಸ್ ಅವರು ದೇ ಹ್ಯಾವ್ ಟು ಮೇಕ್ ಅಲ್ವಾ?
Absolutely.
How important is it, doctor?
Very, very important. So age is relentless. We
Yeah.
cannot do anything. We can only do few things just to reduce the rate at which we are aging, or not actually not rate at which we are aging, but the changes that are happening can be reduced a little,
Okay.
or can be reversed a bit. But unless we take care of ourselves, be healthy, eat healthy, work out, take good rest, and make sure that you are not stressed too much. These are also very important in terms of additions to what we do to make those changes last longer. ತುಂಬ ದಿವಸ ಅದು ಉಳಿಬೇಕು ಅಂತಂದರೆ ಇದೆಲ್ಲ ಬೇಕಾಗ್ತದೆ. ಸರ್ಜರಿ ಮಾಡಿದ ತಕ್ಷಣ ಎವ್ರಿಥಿಂಗ್ ವಿಲ್ ನಾಟ್ ಸೆಟ್ ರೈಟ್ ಕಂಪ್ಲೀಟ್ಲಿ.
And when it comes to other department and other surgeries, there is say 3 months follow up, 6 months follow up, ಅಥವಾ ಲೈಫ್ ಲಾಂಗ್ ಇಷ್ಟು ತಿಂಗಳಿಗೆ ಒಂದ್ಸಲ ಚೆಕಪ್ ಮಾಡಿಸ್ತಾ ಇರಬೇಕು. ಇಸ್ ಇಟ್ ದ ಸೇಮ್ ವಿತ್ reconstructive ಅಥವಾ aesthetic surgery, plastic surgery also?
Generally speaking, about 3 to 6 months follow up is required, because that is when most of the scars mature and become all right. And by the way, most people think that cosmetic surgery or aesthetic surgery scar ಇಲ್ದಲೇ ಸರ್ಜರಿ ಮಾಡೋಕ್ಕಾಗ್ತದೆ ಅಂತ. There will be some scars we have to, but these scars are well hidden and generally they are not visible.
Yes, expert doctors.
So what we tell and what we do is make sure that during that period when the scars are maturing, when the scars are becoming better, the patients and the people take care of these things properly as advised by us, so that the end results we can get maximum benefit out of it.
And I think experts like you are actually called so because you hide the scars also very well. Maybe say behind the ears, ಅಥವಾ forehead lines ಗಳಲ್ಲಿ there'll be a very small scar. ನಾವು ಗಮನ ಇಟ್ಟು ನೋಡಿದ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ ಬಹುಶಃ, otherwise it'll not be visible, right? And so one more common perception is that okay, this heroine's got a botox done, ಅಥವಾ this and this person has gone under the knife. ಏನು ಹೇಳ್ತೀವಿ, people believe that this is only for the rich, or this is only for people who have money, who are celebrities, who can spend. But
No, see,
what are your thoughts on that?
India has grown, India's progressed so much. We have so much expendable income now. There are double income families now. There is enough money with everybody. And most of the cosmetic surgeries are not so expensive that it is out of the reach of, say, middle class families. So the fact that, and it has become aspirational. How many middle class people these days don't have a vehicle to, four-wheeler, for example, car? Almost everybody has. Correct. Similarly, so there is money, there is expendable money, not money which is needed for day-to-day. So I don't think we should think in that term that cosmetic surgery, aesthetic surgery is only for the rich and the famous, and or only for the actress and actors and all. Anybody who wants to get it done, I already told, if they have means and if they really want to feel good about it, definitely it helps. There are lots of studies that are gone to show that general mental well-being comes up if they feel good about their body.
And is it like one time and permanent mostly?
Most of them. Most of the cosmetic surgeries in a lifetime, once if you do, it should be done at the right time, and it will be almost lasting for life.
Yeah, so since it's mostly one time and permanent, I think choosing the right doctor and the right hospital, doctor with a very good expertise, and ಒಂದಷ್ಟು ಕೇಸಸ್ ಆ ಥರ ಹ್ಯಾಂಡಲ್ ಮಾಡಿದ್ದಾಗ they would know, and they would also know what to promise. I'm sure doctors like you will never over promise. You will say this is possible, maximum ಅದನ್ನ ಡೆಲಿವರ್ ಮಾಡ್ತೀರಾ.
Absolutely, right? Absolutely. One of the things we need to really look at is that any surgery, just forget about cosmetic or plastic surgery, any surgery when we do, it's an interaction of three things: a good doctor, a good facility, and newest or latest technology. If all three come together, that's when you get the maximum benefit out of it, or the best results. So choosing the right doctor, choosing the right facility, where, see, this medicine is not exact science. There can be instances where things can go wrong, but if there is a facility where we can take care of that immediately and not don't let it go further, that is when it becomes safer. And latest technology is required. With so science is progressing so fast, each equipment or each technology is better than the previous one significantly. So adapting and to these technologies and having them makes these procedures very safe. Plus good results are yielded with that.
And another procedure, which is in fact a household name to reduce the wrinkles and to look young, that is Botox. ಇವತ್ತಿನ ದಿನ ಎಲ್ಲರಿಗೂ ಗೊತ್ತು ಬೊಟಾಕ್ಸ್ ಏನು ಮಾಡುತ್ತೆ ಅಂತ, ಬಟ್ ಐ ಥಿಂಕ್ ಒಂದು ಕ್ವಿಕ್ ಟ್ರಿವಿಯಾ ಅಥವಾ ಫ್ಯಾಕ್ಟ್ ಕೊಡಬೇಕಂದ್ರೆ ಇದು ಒನ್ಸ್ ಇಟ್ ವಾಸ್ ಯೂಸ್ ಟು ಟ್ರೀಟ್ ಮಸಲ್ ಸ್ಪ್ಯಾಸಮ್ಸ್ ಮತ್ತು ಮೈಗ್ರೇನ್ಸ್ಗಳನ್ನು. ಇವತ್ತಿನ ದಿನ ಐ ಥಿಂಕ್ ಇಟ್ಸ್ ಮೇಜರ್ಲಿ ಆ್ಯಂಡ್ ಪ್ರೈಮರ್ಲಿ ಯೂಸ್ಡ್ ರಿಂಕಲ್ಸ್ಗಳ ರಿಡಕ್ಷನ್ ಮಾಡೋದಕ್ಕೆ. ಆ್ಯಂಡ್ ಈ ಥರದ ಸುಮಾರಷ್ಟು ನಾನ್ ಇನ್ವೇಸಿವ್ ಕಾಸ್ಮೆಟಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಇದೆ. ಬಟ್ ಇಸ್ ದೇರ್ ಅ ರೈಟ್ ಏಜ್, ಆರ್ ವುಡ್ ಯು ಸೇ ಈ ಏಜ್ನವರೆಗೂ ಮಾಡಿಸ್ಕೊಳ್ಳೋದು ಓಕೆ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿನ? ಇದರ ನಂತರ ಐ ವುಡ್ ನಾಟ್ ಅಡ್ವೈಸ್ ಅಂತಿದ್ಯಾ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಏಸ್ಥೆಟಿಕ್ ಸರ್ಜರೀಸ್?
So there are two ways: a lower age and the upper age. Okay, you need to be very careful when you do lower age. For example, you should not be doing rhinoplasties, you should not be doing breast surgeries before the age of 18 years. Okay, because the body is still growing, there will be consequences of doing surgeries very early. Likewise, if you go to the other extreme, unless you are healthy and there are no comorbidities, we can stretch those upper limit to quite a bit, 70s 80s allo ಮಾಡಬಹುದು. But if there are comorbidities, there are diseases which prevent us from going and doing this surgery, you need to be very careful and you need to draw a line. That is where the experience comes in.
And I think recovery ಬಗ್ಗೆ mostly people will not talk. We'll usually see before and after pictures and we would know before ಹೇಗಿದ್ರು after ಹೇಗಾದ್ರು, ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಆ ಫೀಚರ್ಸ್ಗಳು ಇನ್ನೂ ಡಿಫೈನ್ಡ್ ಆದವು, ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಆದರು. ಆ್ಯಂಡ್ ನೀವೇ ಒಂದು ಎಕ್ಸಾಂಪಲ್ ಕೊಟ್ರಿ ಅಬೌಟ್ ಅ ಪರ್ಸನ್ ಹೂ ಹ್ಯಾಡ್ ಅನ್ ಇಶ್ಯೂ ವಿತ್ ಹಿಸ್ ಲೋವರ್ ಲಿಪ್ ಆ್ಯಂಡ್ ಹೌ ಇಟ್ ಗಾಟ್ ಬೆಟರ್, ಇಟ್ ಇಂಪ್ರೂವ್ಡ್ ಹಿಸ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಆ್ಯಸ್ ವೆಲ್ ಅಂತ. ಈ ರಿಕವರಿ ಪೀರಿಯಡ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತೀರಾ ಅಂತ? ಬಿಕಾಸ್ ಆ ರಿಕವರಿ ಪೀರಿಯಡಲ್ಲಿ ಪೇಷಂಟ್ನ ಮನಸ್ಥಿತಿ ಕೂಡ ಡೌನ್ ಆಗುವಂಥ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಬಿಕಾಸ್ ಕಂಪ್ಲೀಟ್ ರಿಸಲ್ಟ್ಸ್ನ ಅವಾಗಿನ್ನೂ ನೋಡಿರೋದಿಲ್ಲ. ಮೇ ಬಿ ಹಿ ಆರ್ ಶಿ ವಿಲ್ ಥಿಂಕ್ ಓಕೆ ಇದೇನೋ ಆಗ್ತಾ ಇದೆ, ಬಿಕಾಸ್ ಆ ಕಂಪ್ಲೀಟ್ ಪ್ರಾಸೆಸ್ಗೆ ದೇ ಆರ್ ನಾಟ್ still in the middle of the process. They have to see that end of the tunnel, the light they have to see. So about the recovery period matadodidre,
we had done a study on patients who were undergoing breast reconstruction after cancers. So we did a study on mental status and recovery time, and we found out when we had the same questionnaire in the first week after surgery, all of them said we will not undergo this surgery again.
healing phase ali,
If 1 week early. But believe me, when we finished 6 months and then we asked, all of them said that this is the best decision we had after doing this surgery. I would recommend anybody to undergo this procedure. So there is a phase where you start thinking, why did I get this done? Because of the discomfort, because of the pain, because of the guilt, so many reasons. There will be a phase where it will go down, everything. But once they start seeing the results, their mood, their everything comes up and they become more confident about it. So recovery is very, very important. And during that period, hand-holding by the doctor, by the family, is so important for them to come out of these situations. So adhering to what doctor says and leading little bit of healthy life, whatever is possible from their side, makes a huge difference in the recovery.
Doctor, I think none of us as human beings, we are happy with what God has given us. ಏನೋ ಒಂದು ಅದ್ರಲ್ಲಿ ಕೊರೆ ಹುಡುಕ್ತೀವಿ, ಥಿಂಕಿಂಗ್ ಇದೊಂದು ಚೆನ್ನಾಗಿರಬೇಕಿತ್ತು, ಅದೊಂದು ಹೀಗಿರಬೇಕಿತ್ತು, ಹಾಗಿರಬೇಕಿತ್ತು ಅಂತ. ಬಟ್ ಐ ಥಿಂಕ್ ಬಿಫೋರ್ ಕನ್ಸಿಡರಿಂಗ್ ಅ ಸರ್ಜರಿ, ನಾವೊಬ್ಬ ರೆಪ್ಯೂಟೆಡ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿ ಡಿಸ್ಕಸ್ ಮಾಡೋದು ಕೂಡ ಇಟ್ಸ್ ಸೋ ಇಂಪಾರ್ಟೆಂಟ್, ಬಿಕಾಸ್ ಐ ಆಮ್ ವೆರಿ ಶ್ಯೂರ್ ಪೀಪಲ್ ಲೈಕ್ ಯು ವಿಲ್ ಮೇಕ್ ಅಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಇದರ ನಂತರ ಹೇಗಾಗುತ್ತೆ ಅಂತ. ಬಿಕಾಸ್ ಐ ಆಮ್ ಆಲ್ಸೋ ವೆರಿ ಶ್ಯೂರ್ ದಟ್ ಏನೇ ನಾವು ಮಾಡಿಸ್ಕೊಂಡ ನಂತರ ಕೂಡ ವಿ ವಿಲ್ ನೆವರ್ ಬಿ 100% ಹ್ಯಾಪಿ ವಿತ್ ಅಸ್, ರೈಟ್? ಸೊ ಆ ಕೌನ್ಸಿಲಿಂಗ್ನ ಇಂಪಾರ್ಟೆನ್ಸ್ನ ಇಫ್ ಯುಲ್ ಹ್ಯಾವ್ ಟು ಶೇರ್, ಅಂದರೆ before the surgery and after the surgery, I think counseling also plays an important role. You'll have to make them understand the realistics of life, right?
When somebody comes and sits in the consultation room, once I hear what they want, we go about in two ways. Now technology is there where we can actually show them on with software what ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ವಾಟ್ ದೇ ಆರ್ ಲುಕಿಂಗ್ ಫಾರ್. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಒಂದು ನೋಸ್ ಏನು ಸ್ವಲ್ಪ ಬೆಂಡಿದೆ ಅಂದರೆ ಅದನ್ನು ಸ್ಟ್ರೈಟ್ ಮಾಡಿ ತೋರಿಸ್ಬೋದು, ಈ ಥರ ಮಾಡಿದ್ರೆ ನಿಮಗೆ ಚೆನ್ನಾಗಿ ಕಾಣ್ತದ, ಆರ್ ಯು ಹ್ಯಾಪಿ ವಿತ್ ದಿಸ್ ಅಂತ. ಸೊ ಬಟ್ ಆಲ್ಸೋ ವಿ ನೀಡ್ ಟು ಹ್ಯಾವ್ ಎ ಡಿಸ್ಕ್ಲೈಮರ್ ಟೆಲ್ಲಿಂಗ್ ದಟ್ ವಾಟ್ ಯು ಸಿ ಹಿಯರ್ ಇಸ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ನಾಟ್ ವಾಟ್ ವಿ ಕ್ಯಾನ್ ಅಚೀವ್, ಬಟ್ ರಫ್ಲಿ ವಾಟ್
ಇಸ್ ದ ಪರ್ಸೆಂಟೇಜ್ ದಟ್ ಅಪ್ರಾಕ್ಸಿಮೇಟ್ಲಿ ಒಂದು ಪರ್ಸೆಂಟೇಜ್ ಕೊಡಬೇಕಾದ್ರೆ ದಟ್ ಯು ವುಡ್ ಪ್ರಾಮಿಸ್ ಇದಕ್ಕೆ ಇಷ್ಟು ಪರ್ಸೆಂಟ್ ಹತ್ತಿರದಲ್ಲಿ ಬರ್ತೀವಿ?
Between 80 to 90% we can achieve that much. But they should not cling on to that and say, no, ಈ ಥರ ತೋರಿಸಿದ್ರೆ ಹಿಂಗೆ ಆಗಲೇ ಇಲ್ಲ ಅಂತ. ಬಟ್ ರಫ್ ಆಗಿ ಈ ಥರ ಮಾಡ್ಬೋದು ನಿಮಗೆ. ಸೊ ವೆನ್ ದೇ ಕಮ್ ಅಂಡ್ ಆಸ್ಕ್ ಫಾರ್ ಸಮಥಿಂಗ್, ದಟ್ ಈಸ್ ವಾಟ್ ದೇ ಆರ್ ಡಿಸೈರಿಂಗ್. ಬಟ್ scientifically and medically, sometimes it's not possible. And explaining to them and making sure that they understand that is the most important conversation we have. Sometimes in a rhinoplasty, I will have at least 3 or 4 consultations before I take them up for surgery. And there are always red flags that come up when we discuss, and people who have something like what we call as body dysmorphic syndrome ಅಂತ ಹೇಳ್ತೀವಿ. People are obsessed with something which is very, so those are very, very difficult people to treat. Whatever we achieve, they will not be satisfied, and those are the ones we should not be. But we, about 80 to 90% of people who come, they have serious issues and genuine problems that we can address with cosmetic surgery.
And worldwide, the numbers are increasing every day. Plastic surgery ಮಾಡಿಸ್ಕೊಳ್ಳುವಂಥವ್ರ ಸಂಖ್ಯೆ is increasing. But still, I think full credits ಸುಶ್ರುತ ಸಂಹಿತೆಗೆ ಹೋಗಬೇಕು. ಯಾಕಂದರೆ ಆ ಕಾಲದಲ್ಲಿ ಎಷ್ಟು ಅಡ್ವಾನ್ಸ್ಡ್ ಆಗಿ ಯೋಚನೆ ಮಾಡಿ ಇವತ್ತು ಪರ್ಫಾರ್ಮ್ ಮಾಡ್ತಿರುವಂಥ ಸರ್ಜರೀಸ್ಗಳು, ಇಟ್ ವಾಸ್ ಡಿಫೈನ್ಡ್ ಸೋ ವೆಲ್ ಇನ್ ಸುಶ್ರುತ ಸಂಹಿತೆ ಬೈ
Absolutely. That was 5000 BC. And even today, the rhinoplasty method where nose reconstruction is done is called Indian method of rhinoplasty.
Oh, wow.
So that is the importance that is given to him. And this was prehistoric, right? There was no anesthesia, there was no autoclaving and antisepsis, but instruments what we use even today, exact instruments have been described and all picturized, like this is how it should look. And in that book, Sushruta Samhita, it's all there, 500 BC.
ಅನ್ಬಿಲೀವಬಲ್. ಇದೇ ಥರದ ಅನ್ಬಿಲೀವಬಲ್ ರಿಸಲ್ಟ್ಸ್ಗಳನ್ನು ಕೊಡ್ತಾ ಇರುವಂತಹ ನಿಮ್ಮಂಥ ಡಾಕ್ಟರ್ಸ್ಗೆ ಹ್ಯಾಟ್ಸ್ ಆಫ್, ಬಿಕಾಸ್ ಸಾಕಷ್ಟು ಜನರಲ್ಲಿ ಯು ಆರ್ ಟು ಗೆಟ್ ದೇರ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಬ್ಯಾಕ್, ಯು ಆರ್ ಹೆಲ್ಪಿಂಗ್ ಅ ಲಾಟ್ ಡಾಕ್ಟರ್. ಸೊ ಆವಾಗಲೇ ಹೇಳಿದ ಹಾಗೆ ನಿಮ್ಮಲ್ಲಿ ಯಾವುದೇ ಒಂದು ಕುಂದು ಕೊರತೆ ಅದರಿಂದ ನಿಮಗೆ ಇಫ್ ಯೋರ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಇಸ್ ಗೆಟಿಂಗ್ ಲೋ, ಪ್ಲೀಸ್ ಮೀಟ್ some expert doctor like a doctor like you, sir, I would say, at Aster Whitefield, and when the counseling session nantara they can take a call as to what they need.
So what we say is that informed decision making. These are all surgeries which are not essential for life, and ultimately it's the patients who have to decide whether they want surgery after listening and weighing the pros and cons, the advantages and disadvantages, the benefits and the complications. ಇದನ್ನೆಲ್ಲ ಒಟ್ಟಿಗೆ ಸೇರಿಸಿ ವೆದರ್ ದಿಸ್ ಪ್ರೊಸೀಜರ್ ಇಸ್ ಗುಡ್ ಫಾರ್ ಮೀ ಅಂತ ಅನಿಸಿದ್ರೆ ಮಾತ್ರ ಮಾಡಬೇಕು. ಸೊ ಇನ್ಫಾರ್ಮ್ಡ್ ಡಿಸಿಷನ್ ಮೇಕಿಂಗ್ ಈಸ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಆಸ್ಪೆಕ್ಟ್ ಆಫ್ ಈಸ್ಥೆಟಿಕ್ ಸರ್ಜರಿ, and that has to be adhered to.
Dr. Ashok sir, thank you so much in the insightful session, and thanks for your time.
Thank you so much.
Thank you.